Dr. Paul here. Do you think it's possible for a baby to break their arm, this part of their arm, while they're being born? Let's go take a look. Hello. Hey, how you guys doing? Pretty good. Okay.
It was a difficult delivery.
Yeah.
When I was pushing, she kind of got stuck.
Yeah.
And when she got stuck, they had to pull her out. So when they pulled her out, they kind of broke her arm.
It was pretty tough. Yeah. So this was the break. You can see the bone broken right there, mid bone. And then if you look over on this side, you can see a shadow of new bone forming. A little shadow around it where that bone is healing. We'll get another close-up here, and I want viewers to see one other thing. This is the broken arm that's working perfect. I mean, it's moving, and we're cute as a button. Look at that cute baby. Look at that cute baby. That's great. Now, this other arm over here is actually moving less. This is a more normal movement. And this one's sort of a little straight and kind of moving a little less coordinated. And what's going on there is what we call a brachial plexus injury. So all the nerves that go down to the hand that go through this part, your axilla, and they can get stretched. I mean, when a baby's being born and they're stuck, it's like a 911 emergency. That baby's got to get out. And I've actually seen OBGYNs putting their foot up and pulling. It's like crazy. Gotta get this baby out. Well, if that arm gets stretched too much, then you can have this happen, which is what we call a brachial plexus injury. So we've got a broken humerus and a brachial plexus, but see, it's already working. And this arm will go back to normal. I've probably seen close to 100 of those, and they all end up normal. So I don't want you to stress about it. But if you're a viewer and your child it has a new brachial plexus injury, obviously have it looked at by an expert, but I've never seen one that didn't heal. So that's the good news. Those nerves just get stretched beyond the point where they're connecting properly, and they need to reconnect. So, let's have a little close-up on one more thing here. This little patch right here, get even closer. So you can see there a little patch of decreased pigment, and that's nothing to worry about. If you happen to have a lot of those, we got another patch here of increased pigment right there. So if this is hyperpigmentation, meaning extra pigment. This is hypopigmentation, meaning less. Neither of those things are anything to worry about. If you have a lot of them, then yes, go see your doctor, because there are some conditions that can be associated with either having too much or too little pigment. We got an awesome baby here who's recovering. The healing of that arm is perfect. Parents who might have a child with a broken arm, you get them dressed by putting on the broken arm first, so that you're not like trying to get it up into the sleeve. And then when you're undressing, you take the broken arm part off last, just so that you're not wrenching that arm a bunch. But we're 6 weeks out from this injury. It's healing beautifully, and it's probably almost as strong as normal. But still, just be careful for a little longer. And you guys, big thumbs up for this amazing family that was willing to share our phenomenal experience. Thanks, both of you. I'm Dr. Paul. Thanks for watching.